start with the immediate, which is that you guys know that New England Narcotic Enforcement Officers Association, or Matthew Gutwill, reached out to me. In front of me, he tested samples of specifically pre-rolled marijuana, and in front of me, it was it was about 10 different samples from 5 different dispensaries. And using his testing apparatus, the THC that was advertised, 28 to 30% in there, they all came back between 18% or even lower in some cases, 10%. So for either of you, this might be for you, Commissioner Roy, what do you think is going on here?
Well, let's just say in the commission, we regulate an $8 billion industry. We honor the will of the voters. And part of the pillars that we are responsible to uphold are public health and public welfare. And we take that very seriously. Also part of that, separating us from the legacy market, is knowing products are tested. I sit in the designated public health seat. I prioritize all initiatives around public health. Part of what I think the state of Massachusetts needs is an internal standards laboratory where we can go to a retailer, buy off the shelf, and independently verify for accuracy. And we don't have that. It's very costly. There are a few states that have it right now. Maryland, I believe Vermont is standing one up. We've advocated for the legislature in our budget, not only for regulated cannabis products, but as we know, there's another issue out there called intoxicating hemp. And these products are supercharged way past the legalized potency that we allow in Massachusetts. So I think the state could benefit from us being able to confirmatory test. Now, we are looking at potency inflation. We also look at heavy metals, pesticides, microbials to make sure that these products are healthy and safe on the shelves. We recently issued a summary suspension order because products were not entered into our seed to sale system accurately for total yeast and mold. And so we levied a very heavy sanction around that. And so that's safeguarding public health. What you're referring to is more consumer and patient fraud. So you pay more for higher potency THC. So folks, patients, consumers are paying additional, and patients need it. If you have a cancer patient, I've had cancer patients tell me they need the higher potency for efficacy. So we don't want to defraud anyone. So we started an internal testing task force. I just met with them right before I sat down here today, and they are looking at potency manipulation as well as protecting, making sure that products pass for total yeast and mold.
So I don't want you to give away any of your secrets, but how does that work? Is it randomized inspections at the testing laboratories or at the dispensaries?
Okay. So right now, we get leads. We get a lot of tips that come in. I actually advocated for a designated tip line for complaints. And we voted on it unanimously as a board, and we're still in the process of standing that up. And we're required to, by our regulations, to have a tip line. All credible leads, we follow up. And some of those lead us to, retailers to purchase the product. We have done that. We have done confirmatory testing based on leads, which did lead to adverse actions and summary suspensions and in stipulated agreements with very high fines. So right now, we are basing it mostly on leads that we get in, and I am advocating for our secret shopper program, which I'd be more than happy to talk more about. So it would be more routine, more random, and more regular, and I can go into greater detail on that.
If I could actually interject here, this is the secret shopper program is something that we raised in this very room over 3 years ago, and we were actually told by senior staff that we had a secret shopper program, which we don't. And one of the things that Commissioner Roy has mentioned is her leadership on this issue. The gold standard will be to have a state-run standards lab that allows us to keep all testing labs to the same standard so that we have confirmatory testing on a regular basis. But the next best thing is to have a secret shopper program. That issue has sort of been dormant for a while. So one of the things I'm most proud of is that I just reappointed Commissioner Roy to lead that task force looking at secret shopper. How can we do this? And I also want to applaud our relatively new executive director. He's actually committed to meet with us over the course of the next couple of weeks. We have a very tight budget right now. We did not get all of our funding from the legislature. There are many things that we need to get funded. We know that the budget is tight all across the Commonwealth, but our executive director has pledged to help us find the resources and to squeeze out every penny so that we can set up at least a rudimentary secret shopper program going forward in 2026.
So let's dig into that a little. You said you brought it up 3 years ago.
Yes.
Yeah.
What do you think prevented leadership at that time from moving forward with that type of program?
I can only say that we thought that it was in existence. We found out that this year, through a tip, that they actually engaged in running a sort of secret shopper program. But it's random. It needs to be something regular. It's not just something that's in response to some tip that someone says, hey, someone may not be doing something right. This needs to be regular. You know, I used to be the state treasurer a number of years ago. At the state lottery, we ran programs like this where we went in on a random basis, but a regular basis, into different licensees to make sure that they were not selling lottery products to underage kids. So that's what we need to do, is to make sure that we have that program, because then it makes the industry police itself. If people in the industry know that someone coming in could be doing that confirmatory testing, they're going to be less likely to engage in any sort of behavior that might have a profit motive as opposed to keeping the public healthy and safe.
Yeah, in my opinion, I think there's a three-pronged approach. And the first is, having an internal reference or standard lab where we can confirmatory test. We've also been meeting with our independent testing labs and standardization. So I could test a product from the same sample batch as the chair, and I could do a process called plating where I culture it, and the chair could do a qPCR, which is more of a molecular test, and from the same batch, we could get wildly different results. Now, did one of us do something nefarious? Maybe not, no, but we got different results. So we're all in agreement. We had a meeting in this room with all the labs over a few weeks ago, and we're gonna work towards, so folks are testing the same way, under the same environment, using the same instrumentation, so they can get similar results from the same sample batch. So that levels the playing field. It makes sure that everybody is doing things through the same protocol. We need to do that. With Secret Shopper, we're kind of boxed in right now with our regulations. The way they currently read, we can only partner with another government agency. So I mentioned that at our last public meeting. We're going to put it in the scope in the beginning of the calendar year for the next round of regulation to adjust that definition. And then we can partner with folks who are on the outside. Now, Secret Shopper does two things. It does, you buy something off the shelf and you make sure the label is accurate through confirmatory testing, but it also does age verification. So in the dawn of social consumption, we want to be able to execute Secret Shopper so we can make sure they are truly checking someone's identification to make sure they're 21 and older. So that program, Secret Shopper, which is in our regulation, accomplishes two things, but right now we are boxed in the way that it is written. So we need to also tackle that as well.
Let's go back to the lab really quickly. You said it's pricey. Is there any appetite in the legislature for an internal testing lab?
I think there is some. Again, it's tricky times for the budget overall, and so we're hearing it could be $3 to $5 million to stand up this laboratory. But I think there is a growing appetite for it, and I'm confident someday that the state of Massachusetts will have one.
And then, okay, so back to Secret Shopper. So you're moving to get rid of this restriction related to who can actually do it for you. So it's not currently in operation, correct, Secret Shopper?
No, I mean, this is to put in place a regularized process by which we do this for all. What has been happening is, on a case-by-case basis, in very few cases, if there's a tip that there might be some product on the shelf that is not properly labeled or may have contaminants because of faulty testing, that's when our investigations and enforcement team would go in. This is to set up something that is regular and that is accountable across the board. And this is one of the things I have to applaud the industry, whether it's the retailers or the manufacturers, the cultivators, but especially the independent testing labs. They have been asking us, please set these standards, because you know what's happening right now? We know that there is an increase in the unregulated market, and that is products that are not tested, that we don't know whether they're pesticides, we don't know what those standards are, and so the regulated market, they pay tremendous amount of overhead and expenses, and that's one of the reasons why we're leading the way on this red tape removal committee, because we're trying to help businesses who are licensed and trying to follow the rules, help them follow the rules. We want to reduce the overhead of unnecessary regulation, but also set clear-cut standards so that everyone is held to the same standard. And it's surprising, but it's also refreshing that they're saying to us, hold us all accountable, help us remove some of these regulations, but also set these standards so that we can keep the public healthy and safe as it's intended to be.
And I mentioned there's 3 prongs to how I see that we can ensure accuracy. And there's standards lab, standardization, everybody tests away, and I'm going to use the third, I'm going to say sunshine. And what I mean by that is sunshine is the best disinfectant, and we are advocating, we have an open data platform, and right now we have a CSV, it's a file that folks can look at, but it's anonymized, so you don't know which lab, you just get a batch number. Thursday's meeting, I will be proposing that we de-anonymize this data. So it won't be lab A, B, C, D, E anymore. You will know the lab, and you will know what they tested, when they tested it, and what the outcome was on potency. And we have a lot of citizen scientists out there, and a lot of real scientists out there who are monitoring this. So if we aggregate the data and we put it publicly, there's the sunshine that will come in, and we can see the anomalies and the outliers for the public to see. So those 3 things working in concert together will help ensure accuracy in labeling.
I'm getting a little bit off of topic here, but was that in reaction to the lawsuit by MCR Labs that named some of these alleged discrepancies between labs?
If I can just, this has been an issue for a number of years, and this is something that commissioners have raised for some time, is how do we hold the labs accountable? How do we set standards? So, we don't really want to comment on the litigation, but the fact is we recognize that there could be a problem here, which is why we're going to talk about more transparency, which is why we're talking about setting standards, which is why we're talking about allowing consumers to be able to protect themselves with this open data. But making sure that when we have open data, saying we have open data is one thing, but making sure that it is understandable so that the public can protect itself, or that our folks in the scientific community can help us. And that's what we've seen, that there have been people from the community that have helped us understand that the problems that we're seeing in multiple jurisdictions could potentially be happening here in Massachusetts too.
Last little secret shopper question, and that is, are there any government agencies that would be willing to participate now or speed up the process? I'm thinking if you have the Attorney General's office or Mass State Police or any local police departments.
So this is one of the things that both Commissioner Roy and I have done, and sometimes it's easy to stay in your lane. And whether, it was brought to my attention several years ago about some of these intoxicating hemp drinks that were being sold, and I got a call from the head of the ABCC. It's not under us. Is it under you? No, it's not under us. I called the state police. I called DPH. Commissioner Roy has led the way on some of this so-called gas station, weed that is available to kids. It's making sure that we understand what our lane is and we're regulating within the cannabis industry, but taking that sort of 10,000 foot level and understanding where are the gaps? How can we make sure that the public is healthy and safe? And then what are those other organizations that we can work with? I have done this already, Commissioner Roy has done this already, but it's making sure that the entirety of some of these state regulatory agencies are working together to keep the public safe and to protect consumers as well.
So Commissioner Roy, you brought up the Assured Lab example of how you guys took swift action and also, created a public database of products that may or may not have been impacted. The one thing the commission did not do was pull those products from shelves. Why was that?
They did, not physically going to the shelves and pulling them off, but we have what's called, we have tools at our disposal, and one of them is an administrative hold. And every licensee is bound to use our seed-to-sale tracking system. It's called Metric. What the commission can do is go in and freeze a product. So it cannot be pulled out of Metric. It can't be sold, it can't be destroyed, it can't be transferred. It's frozen where it is. And then if we deem there is a critical impact to public health, we can issue a quarantine order like we did during the vaping crisis. Remember in COVID, there was a statewide ban on the vaping products. The commission issued a quarantine order because it was considered a serious threat to public health. So those products identified during that time, we placed an administrative hold on, and so therefore they could not be further sold to consumers or patients. Also, our licensees in their SOPs, in their documents to the commission, have to have a product recall procedure in place. Having said that, Can we do more? And can we do better? Yes, we can. And we are working on, when we see on the news, there's a recall on chicken because of salmonella, they say where it was purchased at and, in what to do with it. And so we are trying to, now don't forget, this is still federal legal. We don't have the FDA guiding us. The FDA recalled a blood pressure medicine yesterday. And so all the pharmacies knew what to do with that blood pressure medicine. And we don't have that luxury of a federal agency guiding us. Every state is on our own. And so is there more to do? Yes, there is. But those products, once identified, they were frozen in place and consumers and patients couldn't purchase them. Now, do we need to be a little more consumer and patient friendly in how we explain that? And could we do a little bit more, on our website? Yes, and we are working to have a product recall policy in place.
So they weren't further distributed.
That's right.
But they weren't physically recalled.
Exactly.
Got it. So I guess I have so many questions. There's a lot going on in this industry right now, right? There's a lot to look forward to, and there's a lot of things that are still being ironed out. And if you read critics from either side, whether it's the signature campaign to roll back legal cannabis or it's very pro-cannabis bloggers, sometimes you hear the industry being compared to big tobacco, that the profits are so good that maybe regulators are looking the other way. What would you say to critics like that?
I would disagree with that. I think that the track record this year is that the headwinds have been significant against our cannabis industry here in the state. Close to, I think, 30,000 people are employed by the cannabis industry. It generates nearly $250 million in revenues for mental health programs and restorative justice. So this is something that, we recognize that we are regulators protecting public health and safety, but this is also an economic driver in this state. As a matter of fact, it has exceeded in terms of taxes and revenues coming from alcohol. It is the #1 cash crop in Massachusetts. And so what we have to, and there's also a lot of small entrepreneurs, small businesses that basically they might have mortgaged their house to get into this business because they can't go to a bank because it's federally illegal. So our job is to make sure that we look at ways that we can make this industry function. We also need to be looking at research. We do have a research mandate. I've already had some conversations with folks at the universities, at the hospitals to see how we can do better research to look at the negative side of cannabis so that we can protect the public. As a matter of fact, I applaud the work that Commissioner Roy did. She actually and Commissioner Stebbins led the way to create a program for young drivers about driving while intoxicated on cannabis. And so we have taken a lot of different steps as an agency to make sure that we're protecting the public, we're protecting the economy, but we're also making sure that this is safe. And we just need to have some political will and leadership to be able to move these things forward. When the secret shopper program is languishing for years, it requires leadership. That's why I appointed her to sit on that committee to make things move. And we can talk and we can listen and we can hear and we can hold hearings, but the fact is we've got to get some stuff done. So we are already doing the background work to improve the testing system, to improve the secret shopper program, to do red tape removal, to look at how we can improve the medical marijuana program, which is a whole nother issue that we have to pay attention to because there are a number of medical deserts, if you will, for people who need that as medicine. But we will be hitting the ground running on so many different fronts beginning January. But right now, it's like one of those little ducks that's kind of under the water. You can't see everything, but momentum is happening, and we will be hitting the ground running in January to solve a lot of these problems.
To be clear, with all of these moving parts, you don't think it's the time to hit the pause button?
Well, to your question about profits in the cannabis industry, if you talk directly with our licensees, they would tell you a different story. Imagine having a product that you can't cross state lines, you can't ship it over federal waters, you can't fly it in the air, you have no bankruptcy protections, you have limited to no access to banking, and you have a IRS code called 280E, and you are taxed at an 80 to 90% tax rate because you cannot deduct ordinary business expenses. Now, and also on top of that, we have price compression on cannabis products. And so if you ask them, I think you get a different story, that the profits are not sky high. Even multi-state operators have seen struggles and challenges during this time. And so having a federal illegal product brings a lot of headwinds and makes a very challenging ecosystem.
And while, reminding you that we're speaking in our individual capacity, and I do think that's important, we probably should have started with that. While we are speaking here in our individual capacity, which is sort of flavored and tempered by our experience as commissioners, we also know that there is, that referendum question out there. And one of the issues, again, from my personal perspective, is we have a regulated market. It is intended to provide a safe product for patients and consumers. And I am concerned that we continue to have the ability to regulate those cannabis products that are made available to consumers. That is going to be something going forward. Again, not taking a position one way or another on the referendum question. The voters will be able to decide that. But our job is, as long as this is legal, as long as this is both legal on the medical and recreational side, that we do the best job that we can to keep the public safe.
I have one more law enforcement question, and then I do want to move on to social consumption.
Sure.
And that is, you sort of alluded to this, Chairwoman, that there's the market is very saturated. There's lots of dispensaries, and there is some concern about some of that product potentially making it into the unregulated market. Is that happening, and is the commission doing anything about it?
Actually, one of the things that is happening in the social consumption bill is we've defined diversion, which is taking your product and illegally distributing it. But inversion is taking products that are coming illegally in from out of state or not from the regulated market, and it makes its way into those dispensaries that are licensed. We're having meetings, Commissioner Roy and I are having meetings with people to really study the issue of inversion. New York had a significant problem with inversion. They took major steps, and they are working to really provide heavy penalties for those retailers that are selling products that are not being properly regulated, that are sold to consumers. So inversion is another issue that we're going to be looking at. But again, the commission has already taken action, is going to be defining inversion and diversion, and then in the new year, we're going to be looking at ways that, how does this fit with the testing, how does this fit with the oversight that we are promising the consumers of Massachusetts, that we're protecting them.
And also, we're all going to be looking at possibly hitting the pause button. So I'll be sponsoring on a future agenda, probably in the beginning of the new year, looking at, right now we have over 3 million square feet of canopy and another over 1 million in the pipeline. And, are we at the point of oversaturation? And other states have, temporarily hit the pause button to let the existing people in the space be able to flourish and grow. So that is something we're going to be deliberating on, talking about, getting public feedback from. But, it might be time to hit the pause button for a little while.
Is there any evidence that diversion or inversion is happening in the Commonwealth presently?
That's what we're studying right now. That's why we're having meetings with a number of different stakeholders to understand how it's happening, where it might be happening, and then coming up with a regulatory response to figure out how we can protect the consumers.
No worries. And lastly, something big might be happening on Thursday in this ever-moving industry. What do you expect will happen Thursday as it relates to social consumption?
So this is something that has been studied. It was voted upon by the voters in 2016, and the commission has been studying it as part of a regulatory writing group for almost 3 years. I've been here for back after my illegal suspension. I have been here for about 2.5 months, and we've already held 7 meetings to finalize the drafting of those social consumption regulations. And I am pleased that, as promised, we're going to be able to get this finished by this week, and we will be sending it to the Secretary of State's office, and those regulations will be promulgated shortly thereafter. So this has been a long haul. There are a lot of people who've been waiting for this promise, and it's especially important because it's focused towards the so-called social equity, those persons who've been disproportionately impacted by the war on drugs. So it's another opportunity for those people to have a way to make money in the cannabis industry. This is not going to be an easy slog. Once we pass these regulations, the job's not over. We are setting up a number of working groups, working with municipalities, because just as municipalities have a lot of power to oversee alcohol licenses in their communities, they're going to have significant power to make sure that whatever happens in their community for on-site consumption, that they have a significant hand in making sure that it fits with the sort of local nature and culture of that community, and we're going to be working with them to help them set that up.
And if I may, I just want to commend Cheryl Bryan, because when she first came on board, we were holding 1 meeting a month 11 months out of the year. And, you know, under her leadership, we've hit the, you know, the foot is on the gas, full speed. Since her return in September, just around social consumption alone, between internal and public meetings, there's been over dozens of them to get us to where we are. We want to put a bow on this in time and before Christmas. It looks like Thursday we will honor the will of the voters, you know, and make this a reality. A lot of, to the chair's point, a lot of folks have been waiting for this for a long time. And so I want to commend her for her leadership, because we did really mindful and thoughtful deliberations. We put as many public health and safety safeguards as we could in this license type. And so we're excited to be able to ratify and vote on this on Thursday.
I should probably ask you this on Thursday, but in a perfect world, when would the first social cafe, yoga studio, brewery open?
That's a difficult question to answer, and there have been you know, estimates from anywhere to a year to 18 months. We need to, once we pass the regulations, we also look at guidance, how we can work with communities. And again, we have separate working groups that will be partnering. As a matter of fact, I've been calling several mayors to ask them, some of those communities that have expressed an interest in having that in their community. So there's a lot of work to be done over the course of the next 12 months. But it's hard for us because now it's going to be working with the communities to make sure that they're ready for this, and that one of the things we have to do is make sure, because with alcohol you have breathalyzers, you have different ways that you can, and I know that there are probably a lot of people who are concerned saying, how is this going to work? And I want folks to know that there are many safeguards that we're putting in place to make sure that we are keeping the public safe, the consumers safe, but partnering with communities so they make sure that their communities are safe. So there will be a lot of work to do once the regulations are passed. What can they do? And then we're going to be working with them to say, how will they get it done?
Ladies, I feel like I could sit and talk to you all day.
Oh.
Is there anything else you want to tell me?
Yeah, well, just along those safeguards, we mandated that licensees must have a ride share plan, that they cannot commingle alcohol with cannabis at their sites, that they must serve food and water. We visited different clubs that are unregulated smoke clubs, and they found that these products, THC inhibitor products, were very helpful in that type of setting. So we also allowed opportunity for licensees to carry those as well. So we tried to bake in as many safeguards as we could, and while honoring the will of the voters.
Anything else you want to tell me? I could chat with you
Well,
all day.
yeah, I mean, if I may.
Yeah, please do.
Yeah, I mean, the chair alluded to this, but in the new year, we're going to be looking at testing, which will go a long way to making sure that we have complete accuracy in labeling. And so we're going to revamping the entire testing protocols. We have contracted with 2 outside consultants that are bringing us recommendations. We meet with the independent testing labs on a regular cadence, who have also provided us recommendations to help shape it. And so we also looked at other jurisdictions. We have, when you test for total yeast and mold, we have the most prescriptive thresholds in the entire country. And Connecticut has 100,000 colony forming units. We have 10,000 colony forming units. So maybe we're over prescriptive in certain areas and not prescriptive enough in other areas. And so we're going to take all of those recommendations, synthesize them, and bring it to the public. We're working on that. We're working on the exclusivity period for around our delivery operators, who are equity operators, and do we expand that time frame for them to continue to operate in that space? We're going to be looking at the medical program. We're doing a red tape reduction to remove things that don't make sense anymore, that we can sunset without jeopardizing public health and safety. We have a lot of irons in the fire right now, but it's for the betterment of the industry, and it's also to safeguard public health and safety, but eliminate things that no longer are necessary.